Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzo.
On today's episode, we're going to be talking about a controversial topic, the unhappy or painful total knee replacement.
This is a very hot topic because if you do have a painful or stiff or unhappy knee, you are miserable usually with this situation because you've had a knee replacement and you're just not happy.
And unfortunately, it's quite common. Studies show that 1 in 5 knee replacements are not totally happy for a variety of reasons, and that's what we're going to explore today.
Yeah, and so first off, you're not alone. If you're in the situation, you've had your knee replaced, you're not happy with it, you are not alone. There's definitely a subgroup of people who do not love their total knee replacements.
And it is not in your head. It's a very real problem that has a bunch of different causes and potentially some solutions.
So today we're going to try and help you figure out why you're unhappy with your knee replacement, some things that have to be ruled out that might be causing you this discomfort, and potentially some options to treat it.
So number one reason that people are unhappy with their total knee or unsatisfied is probably residual pain. I would say that all of my knee replacement patients would say that they have less pain than they did when they started, but maybe not as much as they were hoping to get. So often people will not get to a 0 out of 10.
Yes, I mean, I have seen some people say it hurts more than it did before. When I've been referred some patients to give a second opinion, they've had their knee replacement done elsewhere and they come and see me and say my knee replacement still hurts and it actually hurts more than it did before. That's very rare, but it can happen.
Other reasons that people are unhappy, Paul?
Well, stiffness.
Yep.
The knee's stiff, it just doesn't move like you want it to move. Doesn't bend.
Yeah, or unstable. The potential is too loose.
Feels wobbly. Going up the stairs, my knee feels
It's like Goldilocks, too tight, too loose.
Never happy.
Just right. Yeah, and last one?
So what do we say? Stiffness, a residual pain, and it's just not what you expected.
Unmet expectations. By far the number one reason cited in studies is that people's expectations were not met. So they thought it was going to be up here and they end up down low. What do we need to rule out to make sure that it's nothing serious?
So these sure are the things that we say, in that 1 in 5 group that aren't happy, but there are some things. If someone comes in to see me and they say, I've had a total knee replacement and I'm not happy, it hurts, it's swelling, it's giving me problems, there are some things that we have to rule out. And the first thing that I want to rule out is an infection. I want to make sure that that total knee replacement is not infected.
Thankfully, it occurs about 1% of the time, so 99 times out of 100, it's not going to be infection, but it is the one that has potentially more serious complications than the one that's potentially correctable as well. So yes, for sure, infection is number 1 on my list. I'd say loosening is probably number 2, so where the implant loosens from the bone.
Early.
Yep.
It just should loosen maybe 20 years from now, but then all of a sudden in 6 months it's loosened.
Yep.
Or maybe the size is wrong. Maybe the size that was put in you is too big or too small.
Yep. The patella can potentially be a source of pain or dissatisfaction, particularly if it does not track properly. If it tracks to the outside, often it will give you a sensation of instability or possibly more pain.
And the last one I think that comes on this list is referred pain. That's a tricky one because what we're saying is, yeah, you're feeling the pain in your knee, but the pain is coming from somewhere else, like your hip or your back.
Sure. And then just like you were talking about, the other thing that potentially is a cause of this is that you're expecting more out of your knee than it can provide.
Right, expectations. Okay, so what can we do about it?
I'd say the number one thing after you've ruled out the more serious things is to probably get that person back in physiotherapy. For the first 6 or 8 weeks after your operation, you're working really, really hard, and then as time passes, you start to do less and less. Your muscles get weaker, and then often that can be a source of pain again. So I usually push people back into physiotherapy at a minimum.
Yeah, I agree. Physio is so important right after the knee replacement, and if you're developing pain or you're unhappy with it, physio is important. And the physio the second time around might be a little different than the first time around. The first time around, you're just pushing range. The second time around, I'm looking more at a functional type of physiotherapy. So find out what you like to do, if it's cycling or going for walks or hiking. Then the physiotherapy is geared at trying to get you back to that activity despite your knee that you're not totally satisfied with. Does that make sense to you?
Yeah, I tell people their physio should be actually like brushing your teeth. Once you have your knee, I think you should do your physio every day just like brushing your teeth. You should never ever stop physiotherapy because you have now a knee that's made out of metal and plastic, muscles that have been compromised by an operation, so you need to do it every day. And most people won't do that.
I've never heard that one, but I like brush your teeth.
Okay.
Okay.
You should brush your teeth.
So we've told you now why you might be unhappy, some things that have to be ruled out if your knee is still experiencing pain.
Yep.
Some treatment options, certainly the infection we can treat, the malposition we can treat, The other things that we mentioned that have to be ruled out, they can be treated usually with a surgical intervention or a revision. Would you do a revision for someone who's coming in with a stiff and painful total knee replacement that doesn't have one of the things we said to rule out? Infection, tracking problems, size that isn't right, referred pain.
Like, would I ever do one?
No.
So I would probably try to talk that person out of an operation, because I tell them the odds of success probably is 50-50
Like
at
flipping
best.
a coin.
Yeah, which is, I think surgery when you're going in for 50% success does not make a lot of sense to me. So I would push them certain beyond 2 years. I would want them to try to wait as long as they could, try to get as used to it as they could, exhaust non-operative treatment, and then potentially discuss surgery, but that is last resort.
Agreed.
Yeah, I'd say most importantly, it's going to be probably changes in your goal setting, not only after surgery, but ideally before surgery. So sitting down with that patient saying, hey, what are you hoping to get out of your knee replacement? What can't you do now that you're hoping to do afterwards? And I see people who say, hey, I want to run a half marathon. I say, well, then you should do it with the knee that you have now, because once I give you an artificial knee, you're not going to be able to do it, or you definitely should not be able to do it.
Right, so if you're watching this video and you haven't had a knee replaced yet,
Yes.
I'm glad you watched this video, because you really want to make sure that your knee is miserable before you replace it.
Yep.
Because of this subgroup of people that don't love their total knee replacement. I say it's a good operation, it's not a great operation.
Yeah, it's not perfect, but similar to your analogy is when I have someone in my waiting room that has difficulty getting from the waiting room to the exam room, which is about 30 feet, if they're miserable in that walk, that person always thanks me. They love their knee. But it's the 52-year-old guy that wants to be in the backwoods doing extreme parkour or a half marathon. That guy's not happy with his artificial knee.
Agree. And the other group that may not totally be happy is that post-traumatic group.
Yes. Why is that?
Well, if you had a perfectly fine knee, then you get hit by a car or some sort of trauma and your knee gets destroyed and you need a knee replacement, then you have your knee replaced. There's a better chance, a higher chance that you won't be happy with that knee replacement because you haven't been in pain with a miserable knee for a long time, like the degenerative arthritic knee.
Yeah, and there are good studies that show exactly what you're talking about, because they remember their normal, which was perfect 2 years ago, whereas an arthritic person remembers their normal that was horrible a year and a half ago, and it was perfect 15 years ago that they can't remember at all. All good points.
Right, so your knee hurts after total knee replacement. A few things have to be ruled out, but the overwhelming odds are you're part of that 1 in 5 people that just aren't happy with their total knee replacement for the reasons that we've discussed.
Try to delay as long as you can, and once you get it, work your buns off to get your motion and your strength back as much as possible.
By the way, I like what you've done at the studio. It's a real change for us.
Absolutely.
It's nice to have other people actually working the cameras instead of a selfie stick.
Absolutely. So if you like this video, please like us on YouTube and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.